I'm pleased to report that our surveillance information is back online following the disruption earlier this week, and I want to thank the crews who worked tirelessly night and day to make that happen. With this new data, as the Premier reported, we have identified 239 new cases of COVID-19 in Alberta in the last 24 hours. This includes 134 lab-confirmed cases and 105 new probable cases, which is a combination of the last 3 days' numbers of probable cases. While this number is a high daily total, I want to remind people that we did expand our testing access this week, and we expected to see more new cases as we test more Albertans. As you heard earlier, in the last 24 hours, we did 3,831 COVID tests. Another reason for the recent increase in case numbers can be attributed in part to a surge in cases identified in households linked to a meat packing facility in High River. There are now 358 cases linked to this outbreak involving multiple connected households. Some of these households are in surrounding communities such as Calgary, and current information suggests that the cases in this outbreak are primarily linked to household transmission. Alberta Health Services has put together a dedicated outbreak response team to track this High River outbreak and to prevent further infections at any locations where transmission is occurring. Today's new cases bring the total number of Alberta's COVID-19 cases to 2,397. Of these, 1,124 people have recovered. We suspect 400 of our total cases may be as a result of community transmission from an unknown source. This number has increased and is a concern. The locations where transmission is happening will be part of my update next week once we have had more time with the data. Given that we lost 2 days of access this week, we have not had time to do this yet. There have been no new deaths over the last 24 hours, leaving our total at 50. Of these, 32 were in residents of continuing care facilities. I know that people who have loved ones in long-term care and continuing care facilities are concerned about the risk of infection at these sites. I am too. It is not acceptable that elderly Albertans are being put at risk in a place where their health is supposed to be protected. We have put strong measures in place to limit the spread of infection at these facilities. We must do more. That is why I am working with Alberta Health Services to expand testing in the units of continuing care facilities that are experiencing outbreaks to now include asymptomatic residents and staff. This expanded testing does not replace or change any of our outbreak measures, and a negative test in someone with no symptoms does not change a need to be isolated for 14 days if they are a close contact of a confirmed case. What it does is gives us a better chance of early identification of new cases. Given that we now know people who may be infected with COVID-19 can potentially spread the illness before they show symptoms, testing more residents and staff in continuing care facilities will help us prevent further infections and deaths. Having said that, testing is only one part of the larger response, and it must be taken in that context. I know staff at these sites are doing everything they can to keep these residents safe, and we will continue to support them by ensuring our requirements around visitation, sanitization, and personal protective equipment are rigorously followed at all times. We cannot let up on these requirements during this crucial time. One particular situation I wish to inform you about today is the outbreak at the Manoir du Lac Continuing Care Facility. Earlier today, Alberta Health Services issued a news release indicating that they will be taking over administration of this facility after Public Health determined that protocols for keeping residents safe and well cared for were not being followed. The health and safety of residents in our seniors' care facilities is of utmost importance, and these measures are being taken to ensure that residents get the care they need. While we are focusing on this group at the highest risk of severe illness, we still need to protect each other in the general population as well. We must continue to stay home when possible, practice physical distancing when we need to leave the house, and If we experience any of the symptoms of COVID-19, including fever, cough, runny nose, sore throat, or shortness of breath, we must self-isolate immediately and complete an online self-assessment at the Alberta Health Services website to be referred for an appointment for testing. If you do not have online access, you can call 811 for this referral. If you were directed to get testing through these referrals, please do so. Testing is incredibly important to our COVID response strategy. It helps us trace the spread of infection in our communities and identify any outbreaks as soon as possible so we can work quickly to address them. With increased testing, we will find more cases, and that may bring new exposures at workplaces into view. This gives us an opportunity to be sure that contact tracing and measures to prevent infection are put in place. We are using asymptomatic testing in select outbreak contexts as an additional tool in the toolbox of local public health to make sure that those sites that have outbreaks have access to testing where it's needed and where it can help identify cases early and prevent spread. This knowledge that we will be identifying new cases also gives an opportunity to prepare proactively. I want to remind all employers that you have a responsibility to prevent the spread of infection at your worksite and protect workers and any members of the public who may enter that site. I know many businesses are eager to reopen and serve the public. We are not at that point yet, but continuing to follow public health orders and guidance will help us get there sooner.